Studio 61. It's 9:13. This is Parkinson's Disease Awareness Month, and like so many diseases, it's an important one to talk about now, especially because for many people who suffer from it, the symptoms can very slowly creep up over time without you necessarily noticing. So it's good to know what to look out for. Joining me now, Dr. Adam Simmons. He's the director of the Parkinson's Disease and Movement Disorders Center at the Hospital for Special Care. And a pleasure to meet you, Doctor.
Very nice to meet you, too.
Yeah, thank you for joining us here at
thank you for having me here.
Studio 61. We talk about a lot of different diseases over the course of the many years here. I would like to think that Parkinson's disease at least has some name recognition, if not because of Michael J. Fox. So that's some help for people. But what should they? What do we need to know about sort of how it manifests itself in people?
It can manifest in a lot of different ways. The best well-known symptoms of it really are the motor symptoms, the movement symptoms, things like tremor, difficulty in slowness of movement, lack of coordination, and things affecting gait, especially a lot of shuffling with the gait. But it can affect many other parts of the body. Yeah. And there are a lot of symptoms of Parkinson's that aren't really specific to Parkinson's himself, and most commonly are actually from something else, things like constipation, anxiety, depression, and those sorts of things as well.
And that's what surprised me. Now, it's not just depression because of the state you're in. There's a problem with how your brain makes dopamine, the feel-good chemicals, right?
Dopamine and also serotonin.
Okay.
Which, and so, yes, depression can often come before any of the motor symptoms. So it's actually really from chemical changes in the brain, not just dealing with the disease itself.
It's very interesting. How varied are the symptoms from person to person, and when do they usually have onset?
It can be extremely varied, and no two people really with Parkinson's have the same exact set of symptoms, the same rate of progression of those symptoms. It can occur in a wide range of ages too. You mentioned Michael J. Fox. That's one of the very that's a very young,
early.
That's very young, in his late 20s, but more commonly in someone's 50s, 60s. But the chances of developing it do continue to increase as you get older.
Okay, so what do you folks do at the Hospital for Special Care for people? Maybe should they come to you right after they get a diagnosis when it happens?
Yes, that's definitely a very good time to do that. When someone is newly diagnosed, most likely they'll be referred to a neurologist and hopefully a subspecialist with some training in Parkinson's disease. And at the Hospital for Special Care, we do a very multidisciplinary type approach to it, where people see not only myself, but also see a group of therapists, including physical therapists, occupational therapists, speech therapists, and we try to get people involved in exercise as well, which is really the biggest thing that someone who's newly diagnosed can do for themselves, is to change their lifestyle to incorporate more regular aerobic exercise. That's been shown to slow progression.
Okay. That would make sense, yeah. We're talking about a disease that doesn't have a cure, so it's not necessarily trying to get people on different drugs. It's just trying to keep the body as healthy.
It's trying to keep people functioning as well as they can for as long as they can, and people can live very good lives for a very long time with Parkinson's disease. And I think keeping active, just in general, but mentally, physically, emotionally, and especially getting that aerobic exercise in are really keys.
Now, we were talking a little bit before we went on the air, and I was asking, okay, what do you guys do at the Hospital for Special Care that it sort of sets you apart from other people? And you had mentioned that multidisciplinary approach. How does that wind up helping, as opposed to just having people in all different areas and places?
It helps in it is convenient for the patient, for one thing, in that they can come in on one visit, see both myself and a group of therapists on the same day. And also it helps for us in that we can coordinate their care better, but that we're working more closely with the therapists and talking with them just after they've seen the patient and evaluated them, and so that we can really tailor things more individually for people. And everyone's got such an individual set of symptoms that that's very helpful.
Yeah, it's just, hey, like you said, just being able to go sort of one-stop shopping to see a number of different specialists, that can be a game changer for people. We don't have a lot of time left, and I know you said it's so varied for people symptoms-wise, but what should be maybe the first warning signs that they should at least go to a doctor to get things checked out to see if maybe this is the onset of Parkinson's or something else? Sure.
I mean, probably the most common things that would bring someone to the doctor would be that tremor and changes in their walking.
Yeah.
But overall, people don't have to worry if they have missed early signs, because really the most important things in terms of slowing progression is just a good, healthy lifestyle, which hopefully they should be doing anyways.
Right, you should be doing that anyways. Okay, well, thank you so much, Doctor. A pleasure to have you. You guys are doing great work there at the Hospital for Special Care. Thanks for joining us.
Thank you for having me on.
Yeah, glad to have you.